This device is called the AIRVO 2, or heated high flow nasal cannula is the kind of generic term for it. This thing does not have an internal battery, so you have to plug it in, oxygen and power. Power button, just plug it into the power outlet like you normally would. And then oxygen, depending on what system you have, plug that in. Usually clicks, that way you know you're ready. Then you can come over to this device and push this power button. A couple seconds, it'll beep. Now this device takes 1 to 3 minutes to actually allow you to make adjustments on the temperature or the flow, but it does start working right away as far as the flow and the FiO2. So the FiO2 is attached with this oxygen supply tubing to this flow meter here. It takes about, again, 1 to 3 minutes to kind of load up, but you can start putting it on your patient, so I'm going to do that now. It'll come probably bagged up or wrapped up. So what you want to do is grab the right interface. We've got a couple different interfaces, couple different brands. What you're trying to do is, you see the nasal prongs there? You want those to be about 2/3 to 3/4 of the nair occluded. If it's fully occluded, you could cause a pressure injury. If it's too small, it's not going to provide that 2 to 7 centimeters of water PEEP that these devices can provide. So all you have to do is open it up and plug it in. It only goes on one way. Come over to your patient. Hey, Mr. Johnson, I'm going to put this high flow cannula on you. It's going to be a lot of pressure in your nose. Just try to relax as we put it on. So again, you can see how the prongs are kind of bending because it's very soft silicone. So make sure that it goes in the nair and get properly sized. There we go. And if these things twist, just kind of untwist them. You don't want it over their forehead. You don't want it over their ears. You kind of want it right above the ear, that kind of area. Generally, you put a prophylactic Mepilex or foam dressing under here so we don't have any pressure injuries on the zygomatic process. You can adjust these straps to make them tighter or looser. There's a little clip right here you can put on their shirt so it's not like pulling on their nose or their face. And then if you want to come back over here, I can show you how this system's set up. It's got it built in already for the water heater pot. So you'll just undo this thing around the clip, take your thing, spike your bag right here, just twist that off. Just like any other IV, put it on, you'll see water come out. And this is a gravity fed system, so it's just going to drain down to here. If you don't spike this bag within a couple minutes, the machine will alarm at you saying like you're drying out their nasal mucosa, so you need to turn this on. Right here, so again, you got temperature, flow, and FiO2. These two things will be changed right here. I'll show you that in a minute. It takes a while for this to do its circle and ding at you, let you know it's ready. But the FiO2 and the flow is already being delivered. This 21%, if I want to increase that, I'm going to come to this flow meter right here where the oxygen supply tubing is connected and then turn it on. So it does have numbers here, but these numbers don't correlate with the FiO2. That beep you just heard was the sound saying it's ready to adjust if you need it. If you come down here, you'll see it says 37% now that I raised the flow meter. So if you need it to be higher, again, come back to the flow meter here, push this up, wait a couple seconds, and then come back down here. Was it 37? Now you're at 61%. So that's how you adjust the FiO2, and you do this based off the SpO2 on the monitor. Work of breathing is flow. So if we want to make any adjustments, we push the play button. It first goes to temperature, then it goes to flow. If I push and hold the up and down button here, in a couple seconds it'll unlock it. And now I can go up, it goes up by 5s to whatever flow they need. So if they're doing okay, they're not breathing too hard, 30 to 40 would be totally fine. Very common is a 50 for a starting point. If they're huffing and puffing 30 to 40 times a minute, you're going to want to go to 60. Push it again to lock it. Now it's on FiO2. Once more to temperature. If they complain it's too hot, get to the temperature one that's at 37, that's the highest. Push and hold these two buttons to unlock this. And there's 3 of them, 31, 34, and 37. You're not going to want to have this off. You're going to have one of those 3 because otherwise it'll really dry out the nasal mucosa. Push it to lock it, and then you're good to go. To change those modes, you'll come back to here. We'll be on the main screen. Push and hold the play button for 5 seconds. You'll see a bird and a butterfly come in here. It'll say junior mode. Now this max flow, you can hear it getting quieter. This max flow is 25 liters. They say 1 to 3 liters per kilogram is a good starting point. So 1.5, we'll have some sheets here hanging up with some examples of liter flow for kilograms. But again, this is at 25. Let's say you got a small kiddo that needs maybe 15. You would get to the flow part, push and hold the up and down button for 3 seconds. You'll see it unlock. Now we'll go by ones. So you'll lower it down to your desired flow rate. And push play to lock it in. And then there's the home screen. If you need to give a nebulizer, just like the other devices we use this AIRVO device. It comes as a separate piece. You would pull this open, make sure that's plugged in, make sure the AIRVO cable is plugged in. It only goes in one way. Take your ampule or your nebulizer packet and squeeze it in there. It'll fill this up with the medication. Close this up, and then come up to this AIRVO box. Then you push this button. You see that turns green? That means it'll start nebulizing down there. It runs for 30 minutes and then it cuts itself off, so you don't have to worry about turning it off.